Since its establishment in 2003, the George Washington University Cancer Institute has been bringing the best resources available to the fight against cancer. GW is the place for advanced research, academic and clinical excellence, and comprehensive outreach and education. With founding principles of commitment, community, and compassion, this urban oncology center has set as part of its mission the elimination of cancer disparities in metropolitan Washington, D.C. A core belief is that cancer's unequal burden on minorities and underserved populations is unacceptable.
African Americans, Hispanics get cancers not necessarily at higher rates, but the type of cancer causes higher morbidity and higher mortality.
GW's mobile mammography program is a signature outreach effort. Cancer Institute recently raised the funds to purchase a new MammaVan and outfit the vehicle with state-of-the-art equipment.
I am living proof that the MammaVan saves lives. Without the services and convenience of the MammaVan, I may not have scheduled that appointment, and the breast cancer could have been further along, and I may not be here today. The MammaVan saved my life.
As it has with breast cancer, the Cancer Institute is now working with GW's hospital and medical faculty associates to create a comprehensive men's oncology program that integrates research, education, and community outreach with the most innovative and technically advanced clinical care available. Against prostate cancer, GW is bringing prevention and screening initiatives to D.C. neighborhoods with its Community by Community Cancer Control campaign, funded by a grant from the Amgen Foundation. GW is also marshaling advances like robotic surgery, minimally invasive radiation, and new possibilities for established treatments like brachytherapy, the use of tiny radioactive seeds implanted directly into malignant tissue.
They're half the size of a grain of rice, and they're put in with ultrasound-guided imaging.
The minimally invasive approach to men's oncology at GW extends beyond just prostate cancer, according to Dr. Tom Jarrett, whom the GW Cancer Institute is pleased to welcome as chair of urology and key pillar in the men's oncology program.
Kidney cancer is virtually almost treated with a less invasive approach, as is testis cancer, bladder cancer, and many other malignancies. So I think that we will continue to be on the cutting edge at George Washington in offering these less invasive therapies for the benefits of our patient.
Elsewhere, the GW Cancer Institute is enlisting advanced research techniques to further our understanding of DNA and the power of genetics in the fight against cancer. One collaboration between the Cancer Institute and GW's Catherine Birch McCormick Genomics Center involves oncogenomics, which employs genetic imaging on a massive scale to chart the onset of cancer.
Genomics is the process of being able to look at genes simultaneously, and we can display almost overnight the genes that differ between patients that have cancer and patients that don't.
From genomics and robotic surgery to digital imaging and new PET CT scanning options at GW Hospital, the technology is impressive. But a key ingredient to the Cancer Institute's success remains the dedication of its people. Physicians, researchers, technicians, and medical specialists of all kinds working together. Thanks to funding by the National Cancer Institute, GW is now implementing a DC citywide patient navigator program. More than $3 million will help launch a corps of patient navigators, trained specialists who can help patients deal with an often complex and confusing healthcare system.
People who are skilled at helping individuals work their way through the medical system at GW and a number of other places, exactly for that reason, to make it easier for them to come and see the doctor.
The Navigator program being run by the Cancer Institute is going to allow us to do on a citywide basis what has been done on a grassroots basis through ordinary citizens, social workers, people throughout the community trying to kind of cobble together a system to catch people so that they don't fall through the cracks.
Renee Drummond and her fiance Chris know firsthand the benefits that come with the Cancer Institute's comprehensive and personal approach. They began coming to GW soon after Renee was diagnosed with breast cancer.
As far as research, as far as, when I get stressed out, who I can talk with, like support groups. When I come in and I sit down and knowing I got to, get the the tape, the IV and stuff done. It's always somebody that makes my day.
And she's going through a whole lot, and I'm up to here, she's up to here, and sometimes you need a little help, and I get it here.
The technology, the people, celebrating life and marshaling the resources to fight the deadliest forms of cancer. The George Washington University Cancer Institute. Commitment, community, compassion. A comprehensive urban oncology center bringing the best in cancer care to the nation's capital.